Good morning, everybody, and welcome back after your break. I hope you have managed to refresh your cups, have a nice move around and keep active during the time that we're not sitting here listening to our wonderful speakers. So we are back for a session to talk about the priorities and opportunities for developing the link worker role and the actions being taken across the country and indeed the United Kingdom around the opportunities to support the workforce that we've created and been growing since 2019. So I'm Sian Brand. I am a steering group member of the National Social Prescribing Network, working with Marie and a number of great colleagues. And I also support the East of England as a regional associate, working as a learning coordinator, supporting over 250 link workers in the East of England around their learning and development and issues they may come across, such as supervision. So since 2019, the link workers have been coming into the role through the NHS funding. We've had a number of link workers that are funded by other sources, so local authorities, grant funding, even the lottery. So all of these link workers have been developing the profession for a good 3 years now, and we have seen huge challenges and huge changes in the support that's needed for them in their training, their learning and their career. And we will be talking to a number of people, Christiana Melam, Nic Gitsham, Krysia Groves and Hannah Byrne. And I have the pleasure to welcome Sam Sales, who is my co-chair for today's session. Sam is a link worker manager in Cambridge City. Sam, do you want to say a few words?
Oh, morning. Thank you, Sian. And yeah, absolutely fantastic. And I'm delighted to be here this morning. And I'm one of the social prescribers that Sian supports, which is fantastic. And I work with a great team, and there's 5 of us who support the Cambridge City PCN in the East of England. So thank you, Sian.
Thanks, Sam. Sam will be keeping an eye on all your questions coming through. So really do dig deep for our speakers today and challenge them with some great questions throughout the session. So without further ado, it's my pleasure to welcome Christiana Melam, Chief Exec of the National Association of Link Workers, to give her presentation. Christiana, the floor is yours.
Thank you so much, Sian, and thank you everybody for tuning in to listen to me. I hope you like my glasses. I made an effort today for you guys. So I'm just going to share my screen and hopefully you can all see that. So the first thing I want to talk about is for us to understand that we would not be here today if it wasn't for social prescribing link workers. So if what we are referring to is signposting, or there is no social prescribing link worker involvement in that, that is signposting, or another posh name for community capacity building. So let's just be very clear on why is there a global movement of social prescribing? Why now? What problem is it solving? And just make sure that we're not getting excited for just getting excited reason. Why are we getting excited? What problem is social prescribing helping us to solve? And why has it come up the agenda? So I just want to start off with when we had our conference in 2019, we had Lord Victor Adebowale, who is the chair of NHS Confederation, and he said that our future relies on the success of social prescribing link workers. So it's very important we understand this. And he made a case that this is about reversing the inverse care law. This is about social justice and inequalities. So it is about signposting. Public health interventions could have a tendency of increasing health inequalities if we're not very clear on what we're actually doing. So I'm just going to briefly cover 3 subjects. I appreciate that this is a global audience, so some of you might not be familiar with the National Association of Link Workers. So what we're about is we set it up as a grassroots movement. And again, it was through some of the events that we had a few years ago that some social prescribing link workers and myself came together and wanted to take action and do something about it. We do have a role in representing the views of our members as well. We are member driven, and our membership is largely employer sponsored, and it's comprised of people from a range of social prescribing models, but those that actually employ link workers and not just the activity as well. So the priorities, well, this is not just my priority. This is not just about the people on this panel. So it is your priority as well. So if we want social prescribing link workers to succeed, you are passionate about reducing health inequalities, you're passionate about social injustice, you want to take action, you need to take action now. So screenshot this screen, post it on social media. Who needs to take action? Tell me, what commitments are you going to make? How are you going to support social prescribing link workers in their mission to try to reduce to reverse the inverse care law? Or are you just going to be, thank you very much for coming to watch me, but watching me is not going to be enough, because change only happens when we take action. I took action and set up the National Association of Link Workers with some social prescribing link workers. Polly and Michael took action by actually setting up the social prescribing network. Nobody's giving anybody money to take action. People on this panel are taking action. What action are you taking to make sure that they succeed as well? So I'm just going to walk through that and show you some examples that actually relate to that and some evidence that we have found. So we need an education standards, and NLW is doing something about that. Competency framework, accreditation and qualification. What is your nation doing about it? What is your work stream doing about it? How can you help address these priorities? You can do something, you're not powerless. Who needs to know about these priorities? Go and email them. I want to see your email. I want to see you. Email us if you know you can help. Tweet on social media. Who needs to know about these priorities? Are you an education provider? Are you an academic institution listening to me right now? How can you help us get qualification for social prescribing link workers? How can you help us deliver high-level training that meets the need of social prescribing link workers? Are you creating confusion and you don't understand the role or the role boundaries? How can you educate yourself to make sure that we are not, in effect, making the role become at risk because we're not describing it correctly? Code of practice and ethics. So our members, they become members and they adhere to our code of practice and commit to maintaining their continued professional development. I speak to patients and they want to know what standards are the social prescribing link workers working with. We did a national survey and our members said 95% of them would trust a professional more if they knew they undertake CPD and their code and their practice is underpinned by a code. This is not fluffy stuff. If you're using volunteers, what code of practice are they adhering to? This is a legitimate role, please. Let us not describe this role like it's an afterthought or we are signposters. This is a profession, it is a legitimate role, and we need to be doing all these things here. Supervision and professional regulation. So we responded to a consultation around professional regulation where over 70% of the response were in favor of that. And that is because of the problems that were highlighted in our report, which we released in 2020, which was a UK-wide report that identified that 1 in 3 social prescribing link workers were planning to resign due to a lack of supervision and support. And that is why I'm calling on everybody today to support this workforce. They are living on a groundbreaking transformation change that we've never seen across the healthcare system. This is definitely about integration. This is definitely about prevention. This is definitely about inequalities. This is definitely about reversing the inverse care law. Are we going to allow this workforce to suffer? Are we going to allow this workforce to feel this way? Can they drive this change alone? No. We need you to help us. How are you advocating for this? Take action, take action. You are watching me right now. What action are you taking? Start thinking about the action that you're taking and start going to our website to look at all of this. Continuing professional development and career development. Can you offer career development? We need you. Can you offer CPD? We need you. How can you help us? Help us, help us, help us. Are you a government? Are you a policy maker? Are you a commissioner? Are you a student? Whoever you are listening to me today, we need CPD and we need career development for social prescribing link workers. Are you an employer? Are you paying the correct pay? Are you paying the correct pay? We need social justice for social prescribing link workers that are earning pay that is not what they're doing. This is a complex role and they are carrying a lot of people's hope, challenging the system, fighting for social justice and inequalities. They should not be facing social injustices themselves. So what is NLW doing about it? Well, we've got a code of practice for employers and link workers that is a helpful guidance on what is required and what you should do. We need that to be socialized. We are releasing an education standards in May. We've done a type of supervision videos with NHS England, which I'm sure Nic is going to cover. We are advocating and raising awareness and saying, look at what is going on. How can you help us? How can you help us? That's what I'm here to ask you. How can you help on these priorities? It's not just my social movement. It is also your social movement. I have answered the call. You need to now answer the call now. Go to our website and you can have a look and see what we're doing there. How can you help? You are watching me right now with your dogs, with your pets. How can you help? You are watching me right now and you're hearing what I'm saying. How can you help? Take action. I actually attended an event like this a few years ago and I took action because of my values are founded on social justice and inequalities. This is not just about repeating or actually replacing what is out there. This is about integrating care and making sure that healthcare can deliver the need and the support that people actually need. So it is everybody's business. The priorities for link worker development is not just for people on this panel. They're going to share what they're doing. You that is listening to this presentation, you that is on social media, what can you do? Can you email your NP? Begin to email them now. Are you an education provider? Begin to develop qualifications. Are you an employer? Begin to review your pay. Are you a link worker right now? Begin to join National Association of Link Workers. Are you a patient? Are you a community worker? What can you do? How can you develop us? How can you provide community assets? What training can you provide for us? There is a risk to recruitment, retention, sustainability, quality, and safety if there is no workforce strategy for link workers. If you want to get in touch with me, get in touch right now. I want to be reading your tweets. I want to read your comments. Email National Association of Link Workers now. This is a call for you. This is a call. This is a social responsibility. They are fighting the inverse care law. They're trying to reverse it. It is a call to duty for you to do something about it and not just watch me. Thank you very much.
Thank you so much, Christiana. A very impassioned speech there. Some amazing detail around the challenges that our link workers are facing on a daily basis, but also some great opportunities that you've identified as well to address some of those challenges. So we haven't had any specific questions in yet, so I will, Sam? We
have got one. We've got a great one actually from UCLan, actually, if you don't mind me asking for Christiana. It's really a call out as a university. How they're asking how can they best support link workers? Is it CPD? Is it wellbeing support? They're really open to ideas. What would your advice be to anybody in that sector?
So we do, so there is things, in terms of if you're looking at research, we do need more research. So on our website, we've got research priorities that we want, academic institutions to get involved with. We've got our code of practice. We've also got our education standards, which we need universities to get involved with and discuss that. The provision that is available is not sustainable. And a lot of people are wanting to get into the profession, but they cannot actually get on. So it's not just about just the CPD, it's also the qualifications as well. That means there's legitimacy, because it's a role that values lived experience, but then people want that lived experience to be validated as well. So we are open. So what I'll say to that person is send me an email and let's have a chat about how your institution can actually help address a number of priorities that I have listed.
Thanks, Christiana. Thank you.
Brilliant, super. Thank you for that. We'll move to our next speaker now. I'd like to welcome Nic Gitsham, who is Head of Social Prescribing for NHS England and Improvement. And she's going to be talking about workforce development and support that the NHS and the National Social Prescribing team have been working on. Nic.
Thank you, Sean, and it's fantastic to be with everyone today. Great panel and great to be talking with global colleagues as well and learning from the previous session about how people are developing this really critical workforce for transforming health and care and our local communities. So at NHS England, we have been listening to our stakeholders, listening to link workers, listening to the primary care networks to really understand what's working and not working for this workforce and how to make sure that they receive the support that Christiana just so eloquently set out. And one of the ways that we've done that is through the social prescribing link worker questionnaire that we sent out earlier this year. And what came back was a very strong feeling from social prescribing link workers that they genuinely, the majority, I would say, believes that their job had a huge impact on reducing health inequalities and tackling these wider determinants of health. And as Christiana said, really playing that role around social justice. And the majority said that they would recommend their job to somebody else. But they did highlight some really significant concerns that are around that implementation and how we actually get quality social prescribing and develop this fantastic and support this brilliant workforce across the country. And the sorts of things that they identified was supervision, not getting the supervision that they needed and not getting the quality. They also showed huge variation in training and development for link workers across the country. They expressed concern about how they were built into and valued as part of a multidisciplinary team, and really wanting to make sure that that the primary care networks that they work with and other health professionals and communities and local authorities really understood what their role was about, that it wasn't just signposting, that it was about really working in a transformational way with individuals and with local communities. So at NHS England, we've been doing a number of things over the last year. One is that we've been improving our current offer of training and development and support. But the other thing that we've been doing is working with partners, many of who are on this panel and involved in the conference, to really develop a more professional and sustainable offer for workforce development for this group of staff. It's work in progress, but we're making some really important steps, I think, over the last year. So if we can go, well, it's me, I'm going to take you to the next slide. So here's the existing NHS offer for link workers, and I guess my plea to you all is please share this. What we find, and through Sean's work as a learning coordinator working for NHS England and the East of England, is that one of the biggest problems is people don't know what's already there. So we really encourage you to spread and scale this. So lots of summary guides, technical guidance, the induction pack, handouts for practice staff that help them understand the role. But we also hold fortnightly webinars, and we do that for link workers, but we're increasingly doing it for other people that are responsible for hosting these roles, employing these roles, or really wanting to understand how to use them to redesign local services. And so there we have over 64 of these back there in the back catalogue, and I would really encourage you to listen. If you don't listen to any of them, listen to the one we've done recently about developing the workforce, and some brilliant examples from local places that are really developing good supervision, support and management structures for social prescribing link workers such as Kirklees. So really encourage you to do that. I'm going to talk about the online modules. We've got 12 now. We've also got the collaborative platform. We've got, I think it's now over 5,000 members. We really encourage you to join that and work with us. It's a great way to share, but also it's a brilliant way to influence what NHS is doing around developing that. And we've obviously got the Personalised Care Institute that's got a number of modules. So what's been new for this year? So we've been developing a workforce development framework, which I'll talk about in a minute, and a competency framework. As Christiana said, we commissioned a National Association of Link Workers to do some fantastic supervision videos that we've launched this week. We've been tweeting crazily, please help us share them. We've developed some new e-learning modules based on what link workers said. So we've got children, young people we launched this week, a great one around veteran support and for families and people from armed forces. Supervision, one of the biggest hits, one of the most popular ones, and we've got one coming on culturally responsive practice. So please spread and scale them. And we've been working with the training hubs to really help to improve the supervision offers within integrated care systems with primary care and help develop those training hubs to do that. So the workforce development framework. So this is the framework that will set out how to develop the workforce. It's for employers, it's for link workers, it's for anybody involved in trying to spread and scale social prescribing. And it will really help people understand what the role is, what's critical, what needs to be in place to help these roles flourish, what the key competencies are, and what the existing resources are, and signposting not just to ours but also to others. We're about to put this onto the collaborative platform in spring. Please comment, please be part of that. We've done a lot of stakeholder engagement with lots of stakeholders, link workers, PCNs, host organisations, but we want your support. This is your workforce development framework. Please help us to work on that. And the first thing, which is part of that we're launching, is the Competency Framework. And the Competency Framework really sets out the key competencies for link workers. So regardless of whether they're working in primary care, whether they're focusing on mental health, whether they're working, as we heard in Singapore, in community health or other areas, these are the core competencies, regardless of whether they're in the NHS or working elsewhere. And that's what we've been working really hard with our stakeholders to develop that. So please comment on that on the collaborative platform. So developing this more professional and sustainable approach to workforce development. We really want this to be a role that is hugely valued. It's one of the most important roles, I think, in the NHS. I think it's really transformational. And so we want it to have the same value and standing, but we're also needing to develop it in a way that it works across all of the sectors that it works within. So it is quite unique, I think, as a role. So we really need to work across and with you. So I would encourage you to have a look at, join the collaborative platform, have a look at the workforce development framework as it comes up, competency framework straight away, and then help us to get this right for social prescribing link workers. And it's not the end of the journey once we've done this, it's a start, but we need to travel together. Thank you, Sian.
That's fantastic. Thank you very much, Nicola. Again, an incredibly detailed presentation there, highlighting where you've come from and also the plans for the future, which are incredibly supportive of the development of the social prescribing link worker role. So thank you for that. Sam, have we got any questions that have come up for Nick?
We haven't got any specific questions, but Jo Crease, who's leading the workforce development, has actually posted some really helpful links onto the chat. So competency framework, the modules for e-learning for health. So there's the collaboration platform. So a few really useful links for people to look at, and really just a reminder to everybody that there will be a recording as well of this, so people can catch up and listen to the presentations again. So yeah, just have a look at the chat for some good links.
And Samantha, there was one other thing I was just going to say, as well as working with National Association of Link Workers, we've been doing some work with the National Academy of Social Prescribing, and we've commissioned them to develop a portfolio for link workers where they would be able to capture their learning in relation to the competency framework. And Najnin at National Academy of Social Prescribing done some fantastic work with link workers and employers and PCNs to really get that right, and some of the people on this call.
Perfect, thank you. I'll pop that link up for everybody as well. So thanks, Nick.
And Nick, there is a question here. It's a bit of digging deeper into the relationship between the NHS and other stakeholders, really. So somebody says, how is this linking with the work of the NALW? So is there a risk of duplication? Is the NHS training non-model specific? So, for instance, link workers are currently hosted by a variety of different models and funding streams. So how is this joining together?
Very good point. So I think that's what I mean about that we need to travel together. So at the end, I think I often talk about what are our unique superpowers. So at NHS England, there's certain things we can do with embedding this within the NHS and the way that integrated care systems, primary care works. Christiana can say things that I can't say. You know, they have a particular superpower, as does National Academy of Social Prescribing, as does Social Prescribing Network. The really important thing is that we demonstrate good systems leadership, and we come together to have that shared understanding of what the problem is, what good looks like and how we're going to do that and use our unique superpowers to get there. So so yes, we are working really closely, Sian, to try and avoid duplication and to complement our offer together. And I think you've seen some real improvements in that over the last year, and I'm very grateful to colleagues that from all of the different stakeholders that are helping to do that. But you know, at the end of the day, Sian, it's what does it feel on the ground? We're here to support link workers and people trying to deliver this locally. So if it doesn't feel joined up, you need to tell us and we'll work harder. I think the other thing you said about
that as well. So I think, you know, obviously NHS is a commissioner. So they do have their model and what they want the link workers to, you know, so we are not model specific. It's anybody who wants to utilize social prescribing in any way, and we can provide guidance, and we have all got underpinning framework that applies across. So what's happened is that NHS England is proactive because they've invested heavily in this. So they need to have some kind of support offer, and our role is to support them in that support offer. But it is a program and they're a commission and they're showing leadership. So that's not the profession. Then we also have Scotland colleagues as well that are not here. So it's for every education kind of like arm or statutory organization. What are you doing to support your social prescribing link workers, and we can help you in doing that.
So yeah, that's great. Thank you for that. Let's move on now to our third speaker. I think we have some time at the end, hopefully, if we all travel to time for some further discussion. So we can pick this up again then, which would be great. I'd now like to introduce Krysia Groves. Krysia is a Programme Manager of Primary Care, Health Education and Improvement Wales, and she's going to be talking about the Welsh picture. So Krysia, over to you.
Okay, just get my slides sorted. Right, we good to go? Can you hear me?
Yes, we're good to go.
Oh, good, sorry. Okay, so thank you for the introduction and thank you for inviting me to speak at this amazing conference. There's a lot of energy in the room and a lot of activity that's obviously ongoing. So from Wales, social prescribing has been prominent in Wales for at least the last decade. The Welsh Government has signalled strong support for social prescribing approaches through legislation, a range of policy statements, and certainly those have been coming since 2014. But roles have developed in isolation across public and third sectors with different skills requirements, different job descriptions, employment scales, all those things that have already been mentioned. Consequently, there has been limited consensus across Wales on the required learning, training and education needs of this newly emerging occupational group. And in addition to this, there is no guarantee of clear understanding either by their potential employers or the populations they serve of what social prescribers are actually able to offer. So today, what I'd like to do is share with you not only Wales's ongoing development of the Competency Framework, but also to offer an insight into the national framework that we're developing, of which education and training is a core component. Can I have the next slide, please? Now, I know that this session is designed to specifically examine identified priorities to develop the link worker role and the actions being taken to develop competency frameworks and apprenticeship schemes. But from Wales's perspective, I feel it's important to explain our journey towards us getting this right. So a huge lever to take this agenda forward in Wales is the Connected Community Strategy. This was published in 2020. It's a Welsh Government publication tackling primarily loneliness and social isolation. Next slide, please. The strategy has 4 priority areas focusing on connecting people, developing community infrastructure, and then fortifying the communities within. Next slide. With regard to social prescribing specifically within this document, there are 4 key deliverables. We have baseline mapping to understand the who, the what and the where of social prescribing in Wales. This report has been completed. Competency framework development, and I'll give more of an update on that shortly. A central system to fulfil and maintain the education, training and development needs of the social prescribing workforce. This is a go-to resource that is currently being explored. And with strong academic backing, we're building our evidence-based and outcomes framework that will continue to inform and innovate role and service development. Next slide. So, demonstrating Welsh Government's commitment and the passion for this agenda, Eluned Morgan, our Minister for Mental Health, Wellbeing and Welsh Language, has convened and chaired the Ministerial Social Prescribing Task and Finish Group. This was convened in March 2021, a multi-stakeholder forum with representation across all sectors. The Task and Finish Group seeks to reconnect people with their communities and ensure access to interventions that aren't over-medicalised, to stop unnecessary spending on more pilots, more trials, more proofs of concept, trying to convince the hardline medical fraternity, but to convince them more with the production of robust academic evidence, and to address arising governance issues. All this is building on work already done. Next slide, please. We have a committed Welsh Government driving the agenda. Our service colleagues from across health, social care and voluntary sectors are truly on board, and we also have a strong alliance with our academic partners. The Wales School, excuse me, the Wales School for Social Prescribing Research, WISPR, is a virtual all-Wales school which aims to develop a social prescribing evaluation methodology and build the evidence base for social prescribing in Wales. It's co-chaired by Professor Carolyn Wallace of University South Wales and the WCVA, the Welsh Council for Voluntary Action, which is the national membership body for voluntary organisations in Wales. Next slide. To bring everything together, a national framework is in development. This will comprise the components as shown. We have workforce, leadership, governance, co-production, community assets, sustainability, technology, monitoring and evaluation. The national framework will add value on a once for Wales basis, outlining what best practice looks like in terms of an accepted Welsh model of prescribing, but I hasten to add not dictating how that is delivered in different communities. It'll be used as a guide to support the establishment of social prescribing and community connector services where they either don't exist or where they need to be developed further. It'll support networking, sharing of best practice and learning, and it's to be co-produced so that it complements work and adds value where it's needed. Next slide. The development is well underway, but not quite ready for sharing. It's due for release and for consultation in April, so next month. Next slide. So now that I've outlined the landscape, I can tell you about the progress on the delivery of the actual skills and competency framework. Next slide. Framework development is founded on research. This article, illustrated here, is published in Perspectives of Public Health Journal. This was led by Professor Wallace from the University of South Wales. The study involved the active participation of those in social prescribing roles across Wales, who generated 120 statements in response to research questions. If you can click for the next slide, consensus mapping was used to analyse the input and produce cluster maps of areas of learning needs identified as important to social prescribers. And I know you can't read the text on here, but the cluster map here identifies areas such as interpersonal relationships, networking, socioeconomic disadvantage, gathering and monitoring of data, and so on. So the findings have prompted ongoing research and are now being used to inform the competency framework in development. The second stage of this particular piece of research was a World Cafe style workshop where 85 social prescribers were asked to identify when in their development training and support would be most appropriate and valuable. So we were able to establish a training timeline to some extent. Next slide, please. There's also been a lot of desktop activity. This is me in the top corner here with my coffee and checking my messages, doing my desktop activity. But what I did do is review job descriptions, many of them. This has provided much information and also corroborated the need to standardise language if there is to be clarity around the role and its contribution. You will have heard social prescriber, link worker, community connector, health advisor, wellbeing coach, to name a few. So a glossary of terms is now being drafted to help define social prescribing roles and remits. There's also been a scoping of existing UK-wide education and training alongside a review of associated national occupational standards, and this includes keeping a finger on the pulse of our neighbouring nations, England's development, Scotland's developments. Intelligence that is gathered is being utilised to outline the fundamentals of the framework, the domains, the tiers, the career progressions. Next slide, please. And it's gradually beginning to look like a competency framework. We're identifying our target audiences. These are being defined. Intelligence gathered is being applied, but as yet, the framework lacks the detail of the competency statements. This is obviously what we're working on now. And this is where the framework, next slide, is currently at. The next step is to define and agree the detail that sits within. In addition, alongside this, we are looking at the education and training that will underpin it, looking at academic accreditation, looking at quality assured programmes that will give career progression and a real robust career framework and a pathway for our social prescribers. So no product to show as yet, but definitely getting there. Diolch. Thank you.
Diolch, Krysia. Thank you so much. That was a very enlightening journey there from the Welsh perspective, and really interesting to see the different stages that you're going through and the evidence base that you're collecting by working in partnership with your universities. I'm particularly interested in that mapping of the needs of the link worker as well, and engaging so many of them in your decision making. Sam, any questions in the chat box?
We haven't got anything specific at the moment, not at all. But just a point really on Krysia and the cluster mapping. Just fantastic to look at that, because I think it's a real acknowledgement of there are subtle differences across geographic areas. Yeah, I think to see how that develops is going to be brilliant. So just a well done on the cluster mapping. Brilliant idea.
We're fortunate enough in Wales to be small enough to do this nationally. Yeah. I know there are issues around being able to manage something this big in England. So we are very lucky and we appreciate that, but we have such a huge interest in this agenda, and everyone is truly on board. From all sectors, from all areas. The other thing to say, I think social prescribing in Wales hasn't concentrated quite so much in primary care as it appears to have in England. I know the funding has backed it in England to enable it to do that. We haven't gone that route in Wales. So the majority of our social prescribers are out there in the independent sector or in the local authority sectors, and they straddle across to practice. So it gives a slightly different window of activity that we need to manage. So it's interesting how things have escalated differently.
Absolutely, Krysia, and I've actually taught on one of the level 3 where it was a Welsh contingent, and the diversity of the link workers and where they came from was absolutely amazing. Yeah. And I think that brings a huge richness then to developing that social capital across communities. So what particularly stuck in my mind, the cohort I was supporting had a team of people that were supporting social prescribing and that link working role from the student union. At the university, which was fantastic, and the mixing together of those peers in that link working function really added a huge growth in knowledge, in confidence and in connectivity. So I'm really interested to see how your model develops, and I'll be keeping an eye for sure.
I'll let you all know when it's ready for sharing.
Fabulous. Okay, so thank you for that again, Krysia. I'd now like to introduce Hannah Byrne. She works for the Office for Health Improvement and Disparities, and she's going to be talking to us now about the Community and Health-Being Worker Apprenticeship, which is a level 3 apprenticeship. Welcome, Hannah, and we're really looking forward to hearing about this.
Thanks very much. It's fantastic to be here. So yeah, my name is Hannah Byrne, and I am a Public Health Workforce Development Manager in the Office for Health Improvement and Disparities, OHID, which is a brand new part of the Department of Health and Social Care in the UK government, and it's a successor of Public Health England. So those of you who've not heard of it, you might have heard of Public Health England. So a little bit about what our team do. We have a responsibility for capacity and capability across the public health system in England, but most importantly for today, and the vast majority of my work, is that we lead the trailblazer group that developed the Community Health and Wellbeing Worker Apprenticeship Standard. So I'm here on behalf of that trailblazer group to give you a really quick overview of what an apprenticeship actually is, how they're developed in England, and then an overview of the Community Health and Wellbeing Worker itself and the flexibility that's built into the delivery. And then an idea of some of the benefits it has to the English health and care system, if I've got time, both nationally and at local and community level. So, what is an apprenticeship? An apprenticeship is a paid job, so it combines practical and formal training. And each apprenticeship is a minimum of 20% off the job training, so that might be in a classroom or writing assignments, and then the rest is on the job learning. So you learn from your colleagues, interacting with patients, and the day-to-day work that you do. So apprenticeships are open to all ages over 16, and they're for any stage of the career, so they're not just for school leavers, as many people still think. They're often used to upskill existing staff and grow your own, as well as supporting recruitment. So we even have some directors within the departments who are doing apprenticeships, so we're really encouraging them at all levels. But they form part of your toolkit that is available for workforce development. So a little bit about apprenticeship development in England. Apprenticeship development is employer-led, so employers are part of a trailblazer group with system leaders, skills agencies, professional membership bodies, training providers, and they write the standard, so that's what a fully competent apprentice looks like, and then they also lead the implementation. So the Institute for Apprenticeships and Technical Education oversees the development and approvals of these standards in England, and I've added a little bit more detail on the process and the components that are developed to an annex in the slide deck, because I've just got so much to tell you that I've had to put it all in the back. So the standards are approved in England only because education has devolved, but we've worked very closely with colleagues in Scotland, Wales and Northern Ireland to write them. So with the public health apprenticeships, for example, colleagues in the other home nations were part of the trailblazer group, and we hope to reflect the standards that we've developed together within different education systems and structures. The standards usually take about 2 to 3 years to develop, and we kicked this one off in March 2019. It's been my whole career at Public Health England. It's a long time in the making before that as well to set the groundwork. They're written to be generic, so an apprentice will be employable by any employing organisations. They're also written for a wide audience, so we've resisted the urge to put in any specific public health language. And they're also future-proof, so that you won't find any reference to any specific legislation. Training costs are fully funded, so that's through the apprenticeship levy. So there are options available to organisations who don't pay that levy. So you can be gifted levy from larger organisations, or you can co-invest with the government. But Health Education England are able to support access to funding if you are a non-levy paying organisation. And most importantly, which is why I put it at the bottom of this page, programmes of learning are flexible to the local needs of the employers. So as long as the learning covers the knowledge, skills and behaviours set out in the standard in full, the employer can flex the programme to incorporate any learning. So they could choose to cover some of the knowledge and skills through the NHS e-learning modules described earlier, or they could build that programme around an existing qualification that's aligned to the standard. So that flexibility makes the apprenticeship model a really fantastic way of developing the workforce that you need that could be replicated in other systems as well. So the apprenticeship I'm going to talk to you about today it's taking me to slide 5 to get here, but it's the Community Health and Wellbeing Worker at level 3. It's a brand new apprenticeship that was approved for delivery in September 2021. Community health and wellbeing workers are a really long established workforce, as you've heard, but they're one that's currently rapidly expanding, all supporting that increasing emphasis on improving health of local people and communities by preventing poor health and tackling inequalities. So this workforce will be very familiar to many of you, so I won't dwell on this slide, but I just want to draw attention to a really key point that apprenticeships are written for an occupation. So this apprenticeship, the Community Health and Wellbeing Worker, covers a really wide range of roles. The roles don't have to be called a Community Health and Wellbeing Worker. This is just the name of the apprenticeship to describe the occupation, but they might be employed as a social prescribing link worker, health trainer, care or service navigator, and so many other different roles beyond this. all of the roles in this occupation have the same core knowledge, skills and behaviours, but they may be in different settings, in different sectors. They might have a particular focus, so they might focus on nutrition, but they all fall under the occupation of community health and wellbeing worker when it comes to the apprenticeship and it comes to apprenticeship funding. So apprentices might be then found in different organisations, local government, NHS bodies, primary and secondary healthcare, voluntary and private sectors. But as I said, it all comes back to that ability of employers to work with training providers to flex the apprenticeship delivery to suit their local needs. On the right hand side is just a screenshot of our page on the Institute for Apprenticeships and Technical Education. If the slides are shared, it's all linked, so you can go straight to it. This has all the details of the standard, the assessment, the funding, the level, duration. It also lists all the employers that are involved in the Trailblazer group, and there's a contact email address in that little red box that will come to the Trailblazer group and the team that I work in. So it is a level 3 standard, so that's equivalent to 2 A levels in England, and it's a 12-month duration with an endpoint assessment period, so it's a total duration of 15 months. So at the end of the programme, the apprentice has to demonstrate that they are fully competent in the role and that they have all the required knowledge, skills and behaviours outlined in the standard. But they'll develop this through being, social scribe NIC worker in the role, through the on-the-job and off-the-job training. Apprenticeships must be new learning and experience, so this will work best to upskill existing members of staff into the link worker role or to recruit new link workers. But training providers will have developed programmes of learning with employers for the apprenticeship as a benchmark. Then they can potentially lift that and use that for other parts of the workforce, not through the apprenticeship levy. So it's not restricted, but it is restricted in terms of the funding. We have £7,000 awarded for this apprenticeship, so that means that each apprentice, that's for each apprentice, and the employer is able to draw that £7,000 down from the apprenticeship levy to cover the cost of training. The employer then has to pay for the salary and expenses, but the training element of that is all funded. And the standard is approved by the Personalised Care Institute as well, and aligns to the Personalised Care curriculum that we've mentioned already this morning. So it's taken us a very long time to get to this point where the apprenticeship is available for delivery with a lot of hard work from all of our Trailblazer members and through COVID as well. So we're looking now at the opportunities we have to develop this collectively to deliver and embed the apprenticeship. And I've outlined some of the benefits of the wider health and care system on this slide. I don't think I've got time to run through it all, but it's all about developing the competence and confidence of the workforce, developing retaining staff, investing in your staff and improving motivation, encouraging new ways of working, giving access to formal qualifications, supporting recruitment from the community. So I think I've squeezed as much as I can in about what an apprenticeship is into my minutes, but as I said, I've got the annex. I've got all the detail about the Trailblazer group, career pathways, development process, if you want to see that. But I will just finish with a really quick thanks to the Trailblazer group and all the others mentioned here. The development of this apprenticeship was a huge collaborative effort, over 3 years plus. So it's been fantastic to give you just a bit of a flavour of that today. Thank you.
Thank you so much, Hannah. And I was actually a member of that group and very privileged to join that fast-paced, very exciting journey there to develop that apprentice opportunity. Sam, any questions in the chat?
We haven't actually. No questions.
I have a question for you, Hannah. In terms of it going live, how is the timescale progressing there? Has it gone live? How many people do we have signed up to do it? Are there any GPs taking up the challenge?
So we have a lot of training providers who are interested in delivering it. I think we've got a cohort that's ready to go. It's been ready for a while. It's just been waiting for the procurement to work out. But that is ready to go, I think, up in Leeds. We've done a bit of a survey of all the employers across England and there's huge interest in it. So we're just trying to promote it at the minute and spread the word and get those cohorts up and running, because it really relies on people working together to get cohorts locally. We're trying to encourage people to work with their local training providers, their local colleges, to get a programme that suits them and suits everyone working with them.
I'm sure there'll be plenty of people listening today that would be really interested. So I don't know if you could just share the email address that you've given in the chat box today, because I'm not sure how long we're going to be before we get the slides. So that would be really helpful. And just a question to Krysia, how does apprenticeships work, and is there something similar in Wales?
apprenticeships do work in Wales and in some cases collaboratively with England, but we are a devolved nation, as Hannah has already said, so there are things happening in different ways. Social prescribing isn't on our apprenticeship agenda as yet. However, we're still in the development stage of our competency framework, and when we begin to look at the education that will underpin that framework, that's when we'll have those sort of stronger conversations around the apprenticeship route. It's very much apprenticeship route in Wales as seen as the way forward, particularly for our primary care independent contractors.
Excellent, that's fantastic. Thank you for that update. Sam, are there any other questions in the chat that are general for the discussion? You're on mute.
We have got a question with regards to supervision, actually, and it might be a question for Nick. So a question that's been put forward is, our link workers are hosted in the VCS, but really struggle to get regular and consistent clinical support. And there's a comment with regards to whether a project manager would be a way to push this forward. I don't know whether you've got any advice, Nick, on this matter.
Well, I think Sean and Christiana will could well come in as well. So yeah. I think this is, we're early stages, aren't we, with rolling out the workforce still, and we've got a lot to do. We've had COVID, we've had a lot of pressure on primary care, and it's really working with them in a way to create the right supervision support offers that are there. We've got the DES contract that's very clear about what should be in place, and we're sharing good practice like the videos that we've done with Christiana. But across the country, what we're seeing is people looking at management roles for link workers as we grow that workforce, and certainly the webinar I was referring to earlier with Kirklees is a really good example about how they are looking for opportunities for link workers to go up a grade once they've done a certain level of qualification and move into that sort of more management role, and also making sure that they are part of the primary care network, that the DES requirements, contract requirements are fulfilled around supervision and support, and that we spread and scale that good practice. This year at NHS England, we actually introduced a primary care advisor role. We don't see, over time, we want these integrated care systems to take the responsibility, and our role will change, but at the moment we can still see that there's huge variation. So those primary care advisors and the learning coordinators have worked really closely to sort of hold the hands of some link work at some of the primary care networks to help them develop that and make sure they've got the right support. Sean, I don't know whether you've got any advice, and then maybe Christiana, because I think this is one of the hottest issues. There's no point us recruiting if we're not retaining. This is a fantastic role. It's so needed. We heard from Michael Marmot yesterday, the impact that they can have as part of a system, but they need to have good supervision, support and training.
Absolutely, supervision is key, and I would also add to that around learning and development and training opportunities, that actually coaching approaches and some basic coaching skills to assist those link workers in keeping their boundaries. So I think one of the biggest challenges, and we saw the enthusiasm and the opportunities yesterday throughout the day for link workers, is that they can be seen as the silver bullet for so many different services. Yeah. So discharge, high intensity users, mental health, but actually there are only so many hours in the day, and the link workers are carrying very complex, very high caseloads, and that doesn't take into account either the opportunity to do that community capacity building. Mm-hmm. So supervision is key. We do have the module on the Health Education England platform for all link workers to be able to access as an introduction as to what should be expected. I think what is needed now is to work very closely with primary care networks for them to better understand their responsibilities and the reasons why it's so important that supervision is available on a regular basis to every single link worker. And I think the key to that is beyond training and development and workforce. It's about building relationships. So there are a couple of questions around, the voluntary sector model versus the PCN or the primary care network hosted model. All of it requires us to talk to each other, talk more than you have ever talked before, co-produce, co-design, stick to each other, because actually social prescribing is everybody's business. Yeah. Social prescribing does not equal the link worker alone. We are here to develop system-wide, systemic approaches for social prescribing, and by doing this, you know, with people like Christiana's help, the voluntary sector's involvement, integrated care systems having strategies and understanding the opportunities and the risks, we can actually build the support around the link workers as well as having the direct opportunities for connection. I'd like to come to Christiana now to also comment on supervision. Christiana?
Thank you so much, and that's a brilliant question. So from our perspective, it's about recognizing that this is a legitimate profession. So it's not, okay, if you're employed by this sector or by this, that's when you need supervision. No, this is a legitimate profession, and our code of practice is non-model specific, it's UK-wide, and even some international other organizations have been pinching it, which we don't mind. So every profession, you need that. You need to have supervision. This is about patient safety. This is also about the safety of the social prescribing link workers and those that they serve. So the social prescribing link workers need to have confidence in demanding supervision. So you need it in order to deliver high quality care. You need that in order to identify what your training needs are. And that's why the videos that we did with NHS England, it did show VCSE provider that actually providing supervision and how they've managed to do that. So I think what's been happening, there's not been lots of information out there to empower the social prescribing link workers and also where they work to understand that. Because when we did our research, it was very clear that even within the VCSE sector, there was, you know, a clear understanding in terms of why people need that level of supervision and why line management is not enough. And you also had in GP practices where some GPs were just feeling, well, this is a non-clinical role, why do they need clinical supervision? So part of the action, that's why I'm saying take action, take action. Take action and look at the supervision links that I've provided, educate yourself on what that actually means, what are the example videos, look at our code of practice, and then you can confidently say, I need this. Then you can confidently say to the employer, this is what is required. So let's not kind of like, because we also have link workers now in hospital, in criminal justice systems, you know, and all of that. So it's not just a VCSE or a PCN or destination point of view. Wherever part of the world you're joining in from, if you want to use social prescribing as an approach to help reverse the inverse care law, to address inequality, social injustice, move towards prevention, so that we're not just focusing on the treating the symptoms, but actually intervening early on the vulnerabilities that people are actually facing, then you need to look at the full picture of all the things that they need. Because, I mean, it's not rocket science, is it? If you don't support your staff, you don't provide the right supervision, there is a risk to not just the person, but the worker, your service, and everyone, literally.
Thank you, Christiana. Krysia, I can see you want to come in.
Yeah, I just want to, I echo everything that's been said, but just to say that in Wales, with respect to our competency framework, we're very much cognizant of the need for this supervision and some sort of structure and seniority. So there's room for personal development reviews, there's room for reflection, there's room to you know, to take issues and concerns to another level, but also there's room to progress in your career. And because we are doing it in such a holistic way, we're looking at a service development within the whole system. That hierarchy doesn't necessarily have to be in health. If it's a clinical issue or concern about mental health perhaps or whatever, then perhaps the mental health practitioner would be the one to go to. But if it's something else, perhaps a social issue or a, you know, some other, it could be the social worker that is the person that is that supervisor. So we're very much trying to say it is everyone's business, and our framework will extend from the public awareness level, so the public are aware of what service we're trying to put in place, but also right up to the other end of our clinicians and you know, other professionals who are carrying caseload where this has an impact on them and the population they serve. So we're trying to get that breadth as well as the depth within a competency framework.
That's great, Krysia. So building that systemic approach from the outset. Yeah. So Sam, I'm really interested as a social prescribing link worker manager, what your perspective and view is around the supervision and the reality for you.
Gosh, and I know it's a hot topic at the moment. It really, really is. I mean, I strongly believe in the supervision. It's absolutely key. And, you know, we've spoken about safety of the patient, safety of the social prescriber themselves. I think gosh, it's a role that can't be done really without supervision. It really does need that, as Sian, you said, you know, it needs everybody involved in this role. It's not a standalone role. The social prescriber is not the panacea to every single problem that is happening. It can't happen like that, and that's where the supervision can help, you know, and look at, okay, what is appropriate for the social prescriber to be taking on. Have they got the right caseload? You know, are they supporting their caseload in the right way? All of these things need supervision. This isn't about learning and development. Let's be really clear. It is part of learning, of course it is, but this is not about learning and development. This is about making sure that we're effective but are managing well in how we're doing things. It's just really key. It really is key. I think for our PCN, I know from my perspective, I can't talk for everybody because I know we do have our challenges. I've actually been really lucky. For the 2 years that I've been enrolled, I have actually had supervision all the way through, and it's been there if I've needed it. But I think all I would say is, and I can't encourage it enough, stand firm. If you need the supervision, there's a time and a place to be a pest, and this is one of them. You know, we need supervision to be effective in our roles.
And I think, Sian, it is bringing it into that conversation that the PCN has around clinical governance, or wherever you're working within the NHS. You know, the sort of tying it into some of that as well is really important.
Excellent. Thank you for that, Nic, and thank you, Sam, for your reflections from the grassroots, as it were. So I can see a question in here. Is the aim of the apprenticeship, so one for you, Hannah, scheme to bring in a new workforce or upskill an existing one? And how will this impact on the capacity to employ people on completion? So any reflections on that question there?
Yeah, so apprenticeships have to be new learning or experience. So when somebody applies to be an apprentice, the training provider will look at all the experience and the learning they've done previously. So I think there's been a few comments as well about, if you've got a degree already, can you do this? If a degree is in something completely different, you can still do this. If it's in public health, possibly not. But the training provider would look at all the experience and the learning you've done before and make a judgment on whether they'd be able to access the funding for it. It all comes down to what's eligible for the funding for the apprenticeship. You still might be able to, because they've developed those courses, you may still be able to take part in some of the modules that they've developed as a training provider as a different part of the workforce. But I think it will be primarily for new recruits and for upskilling people in other parts of your workforce. So you could bring somebody in who's been around for a long time within the workforce, but not as a link worker, for example. And then there may be opportunities to develop the apprenticeships, the modules for more experienced link workers, but this is kind of the base and the benchmark of a competent link worker, which we can then build on.
Excellent. Thank you for that, Hannah. And I've seen a couple of comments and queries about degree and post-degree levels. So obviously, and Nic, I'll come to you in a second around this. My perception is it would be down to the universities and the institutions to decide whether they ran those courses or not. And it wouldn't be for NHS England or other statutory bodies to make those available. Nic?
Yeah, so I think for us, it comes down to that roadmap that we're developing and getting those career pathways right, and it comes down to the competency framework. And I think competency framework that we're developing with stakeholders now, Sian, is sort of the main one for link workers. We might find that we need some additional competencies for link workers working in particular areas, and one that springs to mind for me is children and young people, because it's such a different ecosystem you're working with, and there are some additional skills. So I think it's just like our colleagues from Wales are talking about. We look at that and then you see what training and development is required in order to do that. We wouldn't be providing it. We are sort of trying to sort of set the framework, the infrastructure that then people can respond to. So yes, but I think, yeah, it'd be interesting to see how this develops over the years.
Christiana, what have your views on that wider education piece? You're on mute.
Okay, so we need to meet the needs of all social prescribing link workers. So we've got the ones that, you know, on apprenticeship at level 3, which is basically, I think it's O level or something like that. So it's an entry level. So what you've got is a range of skills. So you've got those who've got lived experience, which they believe that with that lived experience and the knowledge they get on the job, they need some kind of validation to recognize that so that they can actually move up. Because there are certain roles, whether we like it or not, you cannot get there if you don't have your skill set and knowledge validated. So it is the interest of the profession for us to start looking at that. So it's not about how people get in, how are you helping them to progress, and recognizing that healthcare, I mean, the NHS is I think is the 6th largest employer in the world or something like that. So let's not, even if it's a non-clinical role, you have to look at how the market is in terms of what areas and what sectors can they work in. And in order to get to a certain level, because I'm always very big on social justice, I don't want them to actually stay there and be like, hey, yes, we are connecting and linking people. So you've got those that have got masters, so those that have got degree level qualifications, you've got those that have got MVQ, you've got those that have got diploma, you've got those that are building their knowledge and the skills. So what I would like to see is options. That's why I'm saying take action, take action. Education providers developing qualifications. What are you doing? Develop learning programs. And that's why we are doing the education standards to at least not be any model specific. We're not about a commissioner that empowers people to then go and develop some of those trainings and qualifications. Because what we've got at the moment is not sufficient. And some people think it's setting them back. Some feel that it's restrictive, and some feel it's not actually meeting their needs. And some are struggling to enter the profession in the first place.
That's fantastic. Thank you. Nic, you're on mute.
So it's not about degrees, but I just think it's really important as we talk about developing this workforce to sort of really think about how we start to address those health inequalities. So something Christiana was saying, and I was saying very much at the social prescribing show last week, is how do employers and that services start to think about how they're really recruiting from local communities, particularly from communities that are most affected by health inequalities. You know, this is an amazing career where you can start with no qualifications and hopefully move on to a whole range of qualifications. So really understanding, you know, and taking that population health management approach to understanding who the communities are in our local areas, who is least served, and how we actually support people to use their knowledge and expertise from their communities to actually to come into this. I think it's a massively transformational opportunity, social prescribing, and our health coaches and our care coordinators. But yeah, that's a very important thing to be doing.
And just thinking as well, actually, those students that, you know, are working in similar studies at degree, masters and PhD level, they're also our researchers of the future. Yeah. That are going to be providing our evidence base, of which we have two following us shortly, leading the East of England session. So we'll hear more about that. So I think encouraging that higher level learning around social prescribing, creative health inequalities is really important as well. Last question very quickly, we have got 1 more minute. So Nic, this is very much for you. What recommendations for existing professional experience for social prescribing link workers to ensure fidelity of the profession whilst apprenticeships are in early stages and will take some time to complete?
I'm not sure I understand that one. Sian, do you want to say something?
So I think it's about the existing experience. How do we build on that and make sure that stays where we're at?
Definitely building on that, and sort of that. I think the important thing is that we continue to work with link workers. It's a hugely diverse workforce. It works across many sectors. People come in with no experience, with loads of experience, with qualifications, without qualifications, and we've got to work together to continue to recognise those core competencies and experience people bring and pull that through to develop a really professional, sustainable offer for social prescribing link workers.
A brilliant wrap up there, Nic. So now I just need to thank you all. Thank you, Christiana, Nic, Krysia and Hannah for your expertise, your presentations, sharing your knowledge and the discussion. And thank you also to my co-chair, Sam. I hope you've enjoyed the session. Take care, everyone.
Bye.
Marie.
So thank you, that's been fantastic. I think that's what we've needed, that discussion for a very long time. So it's been fantastic. We're going to hand straight over to our academic partners for this conference, the University of Essex, and Professor Gina Reinhardt and Dragana Vidovic, Senior Research Officer, have supported this conference, and we're really grateful for the support from the University of Essex. Gina and Dragana, you are going to give us a look now at a region. So we've tried to do this conference in different ways. We've gone international, we're national, we've been very local, and now we're just going to have a region look at the east of England to see how that's working. So Sian is still here. We're welcoming Tim and Tom. So I'm handing straight over.
Thank you so much. It's nice to be here, and we have really enjoyed and been thrilled to learn all that everybody is doing, and also just to hear what everybody has to say and how excited everyone is about this. And what we've decided to do, we're really happy that the University of Essex could co-host this event. We're really grateful to Marie and to the entire Social Prescribing Network conference and the network, which we have been a part of now for a few years. Dragana and I are both at the University of Essex, and we specialize in evaluating the impact of social prescribing, particularly on the individual and the system and the community. So you can hear more about some of the projects we've been working on later today in the breakout sessions and in our poster. And we're happy to speak with anyone at any time. But this session, as Marie has indicated, is really about the social prescribing programs going on in the east of England. And when we reached out to several of the programs going on, people were so excited to show themselves and their programs to you that we thought it would be a good idea to have them do that with short videos, particularly because we have such a short session today. So I will go ahead and share that video and hope very much that the content is available, but it doesn't seem that it is. When I look to what is available to me, somehow all of the files that I was just accessing are not showing up.
Does it give you the option for a window?
It gives me the option to share a window, yes.
Okay, the window might have all the files in it. Just click on the window and see if it shows you stuff.
If you play it in your window,
okay.
We're not using Teams now, we're using Teams Live, which doesn't do live.
I see. Can you see the window of my screen right now?
Yes.
Okay, excellent. Thank you. And apologies for that. Hopefully someone will break in and tell me if this isn't working.
It's just a black screen at the moment. It's not streaming quite fast enough, I don't think.
Okay, let me see. Okay, I think I'm going to have to play it from PowerPoint.
There isn't sound with it at the moment, Gina. Is there a button to share sound at all?
Yes, I did share sound. I am not sure why it isn't sharing. What?
You're currently sharing it through the Teams application and not through PowerPoint.
Okay. So you think I should just play PowerPoint regularly?
Yeah.
I'm very sorry. That's exactly the opposite of what I thought I needed to do. So I'll try this again, and I apologize.
Sean, whilst Gina's doing that, I just wondered if perhaps you and Tim would like to just explain sort of where the East of England is. I know it sounds silly, but we've got a lot of international colleagues, so perhaps someone would like to just give an idea of what that covers.
Tim, kick off.
So if you take where London is, the East of England region is to the north and the east of that and contiguous with it. And we've got the coast of East Anglia, which is some of the most deprived parts of England, as well as places like Cambridge and Hertfordshire and other more affluent parts of the region.
So we have 6 areas: Essex, Suffolk, Norfolk, Cambridgeshire, Bedfordshire, Hertfordshire, and yeah. So there's a mixture of rural and urban. We have some very rural areas out in the countryside, and some larger towns and cities. So Chelmsford, Southend, Norwich, Cambridge. So quite a diverse area and a very significant coastline if you look at it as well. So lots of seaside and coastal employment issues. I think, Gina, you might be able to.
Let's hope so. We'll give it a shot. Thanks, everyone.
No sound.
I could try and do a voiceover.
It's the sound needs to be enabled in the share tray.
I keep doing that.
If you can't hear the sound, we can't hear the sound.
I can hear the sound. But I'll try one more time.
While that's just happening.
All right, let's give it a shot. It takes a few seconds.
Hi, I'm Jim Amflegoff, and I'm one of the regional facilitators for NHS England for social prescribing in the East of England. And I'll get my 2 colleagues to introduce themselves, and we're going to give you a whistle-stop tour of what's been going on in social prescribing in the region since 2014. Sean.
Hello everybody, my name's Sean. I am the regional facilitator, PCN advisor and learning coordinator in the East of England, supporting the regional team. I first came into social prescribing in 2014. I was then working in Mid-Essex CCG, and we were trying to navigate some challenges around a disconnect between community and voluntary services and health and care services. And a different language, and what we were creating at the time was a model of social prescribing, and it was actually a co-produced social prescribing model of over 40 local organisations participating in that design, and it really embraced the whole system approach, which is what we're now trying to move towards now across the country. That also incorporated a number of volunteers into social prescribing. So we trained over 600 champions in our area. So I was really pleased to be joining the national teams and colleagues in 2016 and onwards. And then that led forward to meeting Tim in the East of England and working towards our first conference in 2017. Tim.
And back in 2014, I was working for Hearts Valley's Clinical Commissioning Group, and previously in my role at the County Council, I'd commissioned a service called Hearts Help, which was a single way into the voluntary sector in Hertfordshire. And what we found out quite quickly with Hearts Help, it was great if you were able to pick up the phone and you could take the information that people were giving you, you weren't too upset. But Hearts Help itself was saying, we really need some people on the ground locally that can help put people in touch with the right organisations. At the same time, we were now getting lots of GPs saying, we've got people who come and see us, and actually they don't need medicine, but they're lonely, they need help with housing, all sorts of other problems, and we haven't got time to look into what it is they need. So at that point, we set up something called a community navigator service. And I think, like a lot of people in the country, we were kind of inventing social prescribing. We didn't know that language at the time because it was needed. And as part of that process, we interviewed a young gentleman by the name of Tom Watkins.
Thanks, Tim. So yes, back in 2014, I was part of the original 6 community navigators in West Hertfordshire, and we had no idea what social prescribing was, but we knew our remit, and that was to go out there into the world and really listen to what mattered to people who were experiencing problems and issues with achieving a certain quality of life, and trying to address that by utilising the vast wealth of fantastic things that our community has to offer. And several years hence, 8 years hence, here I am working with the National Academy for Social Prescribing, leading the Thriving Communities programme throughout the east of England. And we deal with the large range of community activities, services, information, advice and guidance that is out there in communities that can help people lead a better life. And if you think about it as the travel agents and the holidays analogy, I was a travel agent, and now I'm looking after the holidays.
And we haven't had a conference in the region since 2020 because of COVID. Back then, we had about 20 link workers, I think, at the conference out of 200 people. We think there are now 200 link workers funded by the NHS England work stream. So it's an incredible change really quite quickly. And I think also it's been a really difficult time in lots of ways for link workers. A lot of them have been come into post during COVID, having to work remotely, doing all sorts of things, but they've been incredibly flexible. And it's great to see that the Royal College of General Practitioners and others have acknowledged just how incredibly valuable they've been during the COVID process. So you're going to hear from a group of projects in the region showcasing the wide range of activity that's going on, and we're really absolutely clear that social prescribing is here to stay in East of England and is going from strength to strength.
Introducing Connected Communities. With local authority partners Suffolk, East Suffolk, Medway, Kent and Byrne, the University of Essex Arise team leads evaluation, dissemination and integration for the Connected Communities project.
Our review was the first to specifically assess the existing evidence of social prescribing as it addresses loneliness. We need more research into the impact of social prescribing programs on participants, populations, and communities in terms of loneliness, isolation, and connectedness.
You may have seen our connectors driving our vans in your area. Link workers and connectors are out and about in several areas in the east of England.
things we're doing now as a team and have been doing really from the start is mapping what is out there in our communities. And I think we're really aware that due to COVID-19, there have been some brilliant community initiatives that have sprung up from very small beginnings, really, in local streets and neighbourhoods that have now become.
She is a beauty, and she's really symbolic. She went down in the winds in the 80s, and her roots ripped out of the ground, but some of them just hung in there. And now there's these branches. The whole tree has just shifted its shape so that it can grow up, and it's grown up into this space. And now it's just symbolic of, right, come on, let's go for it. I'm still alive. We're all still alive. Let's grow and just keep growing and going. It is the tree of optimism, a positivity that things will be okay. It's almost like that mood when you first come and you join a programme, you feel worried and you're sort of closed in, but gradually you're expanding out and almost sucking the energy in from the surroundings and each other.
It's just magical, really. It is, you know, being in such beautiful surroundings. You just can't imagine it, and you're just at ease. You're just at yourself. I weren't feeling myself, you know. I felt really isolated due to the pandemic. A guy I met at my local surgery, as soon as he explained what the Green Light Trust was, something clicked in my mind and said, that's what I want to do. That's what I need to do.
Being in nature, being around people, just really does seem to improve everybody's mental health, their spirit. Some people haven't been out of their own homes for a number of weeks or months even, or spoken to anybody, you know, on a regular basis. It's vital that they come along and they have that time and that space and that security to settle in. And just coming back, even we're on week 4 now of this course, just to see the change in people chatting and being more open just shows that it's really working.
So nature and wildlife has always been a part of me. You know, I've always had a passion for that, and I've always wanted to do more, and I've learnt so much within this short space of time. I feel so confident in myself, and that's what it's all about, you know, bringing your confidence out. I can't thank the Green Light Trust enough, because they've given something back to me that is more precious than anything else. Giving me back my life.
The Hospital and Community Navigation Service, also known as HCNS, is an integrated project that delivers social prescribing to Hertfordshire's 1.2 million residents. Let's take a look what makes the project unique.
The mix of funding from the local authority, the CCGs, and now from NHS England with the 20 or so link workers also in this system has meant we've got a really strong and flexible service that's been incredibly valuable during COVID and able to change and develop new things as different needs have arisen. So I think it's really a good example of the kind of integrated working that we all need to be developing.
We receive at least 1,400 referrals a month into the service. We have a large team of 75 staff employed by 9 different voluntary sector organisations, but we all work on one case management system to gather intelligence on what we are providing within the community.
I manage a fantastic team of both GP and community link workers who are so dedicated.
It made sense for us to employ a link worker through a third-party organisation, Hearts Help. They have significant experience in the community and with social prescribing in Hertfordshire. We were confident that they would have a robust model of management, peer review and clinical supervision for our social prescribing link worker.
This is an overwhelming sense of purpose working for HCNS Hearts Help, because as a team, and it is a team, we function to best meet the needs of our clients professionally, promptly and respectively.
Hertfordshire County Council, who are excellent, really good and very focused and proactive, which is at a joy to have. And the marrying, I suppose, of NHS data and the community data is really key. All of this will add to a really good and very useful data sort of analysis and approach.
HCNS receive referrals from hospital teams, GP surgeries, community teams, as well as self-referrals through Hearts Help, which is one phone number for all Hertfordshire residents to ring if they need support and don't know where to turn.
Anybody in trouble, I strongly recommend they go to Community Navigation. They are wonderful people, always help you.
Because HCNS are able to scale up so quickly, we were involved in a number of projects. During lockdown, we contacted over 6,000 patients on GP vulnerable lists. Because HCNS are able to scale up so quickly, we were involved in a number of projects. During lockdown, we contacted over 6,000 patients on GP vulnerable list, the Waiting Well project, the 2-week hospital discharge wraparound service, veteran project, sensory community link worker project, as well as supporting with the Afghan resettlement programme.
We established a simple process with Hearts Help Hospital and Community Navigation Service so that every person over the age of 65 who is discharged without support is contacted within 24 hours of discharge to check that their transfer had been managed well and that they had settled at home. The beauty of the service is that there is then an offer of further follow-up to check on well-being and explore social prescribing support.
We're having to face many complex cases where sometimes what we have here in our resources at the hospital is not quite enough. In those cases, I have to say that the support of the HCNS service is absolutely invaluable, and I don't know actually how we would be able to discharge the people that we do and support them without that service.
I feel proud to have been able to support just some of the many HCNS initiatives which are under development currently, such as contacting patients on waiting lists to offer support and advice, which I have no doubt will help to meet the many local and national demands and challenges which are continuing to emerge.
Alison and I make up 1/5 of the social prescribing team for the Great Yarmouth and Northern Villages Primary Care Network, and we're pleased to be presenting to you today. Our network covers 10 surgeries, and we're going to spend the next couple of minutes talking to you about how the need in our particular area has resulted in us creating the hybrid social prescribing health coaching role.
Within our team of 10, we have 5 social prescribing health coaches who all came into post with existing health coaching skills and specialisms in frailty and falls, dementia care, learning disabilities and learning difficulties, and long-term conditions such as diabetes and hypertension.
Great Yarmouth has a significant deprivation, a high level of obesity, and a large migrant community working long antisocial hours, often with transient housing arrangements. Where the focus of many social prescribing teams has been to reduce the pressure on GPs and practice staff, our focus has additionally been on reaching out to patients who are not engaging with their GPs at all. We started with diabetic patients who had not had an annual review in over 2 years. Our social prescriber reached out to identify the barriers to attendance and worked with the patient to overcome a myriad of problems that got in the way of attendance. Having built up a relationship with these patients, we realised that it was a natural extension of what matters to me to offer support in making lifestyle changes. Thus, the hybrid role was born.
An example of how our personalised care approach works can be seen through Anna, who was referred by the GP for weight loss, but when contacted was more concerned about her elderly parent. We worked with her to locate the right support for her parent and eventually went back to ask, what about you? What could you do for yourself? This then came back to tackling the weight issue, among other things, and the patient already had a trusted person they could work with.
Our team received many forms of support, from our 8 AM morning huddle on Microsoft Teams, through monthly mentoring group sessions and clinical supervision, to one-to-one development reviews and contact with individual GPs regarding their patients. We attend peer support sessions for both social prescribing and health coaching, and have completed all the recommended training in both areas. The competency framework that we work with is based on the social prescribing framework, but includes additional key points from the health coaching training. We code our work as social prescribing or health coaching according to the needs of the patient. Thank you from both Alison and I for listening. And if you'd like any more information on our hybrid role, please contact jackie.southam@nhs.net. Thank you.
So this is Growing Together Shoebury Ness. When we took it on 8 years ago, it was completely overgrown, nothing here at all, and obviously we've turned it into a beautiful community garden that engages lots of people with mental health issues, learning disabilities, children and other local people.
The video's paused there.
Okay.
Need to, and also ask the staff and other volunteers if they need help, and somewhere where they're not going to be looked down on or put down on.
So tell me what Growing Together means to you.
You get to know people.
Yeah, and is it nice to get out?
Yeah.
And how does it help your mental health?
It's all right because there's loads of other people here, so.
So you're happy that you came?
Yeah.
Brilliant.
Been here for 3 years now.
Yeah, it makes a difference.
Yeah.
Gets me out of the house, meet other people. I enjoy cutting the grass, which I've done for the last 6 years, I think. And look at the result. Lovely place. Just keeps me a bit more motivated rather than sitting home moping. That's really what it's all about. So yeah, it's good.
Hi, my name is Emmy and I'm an engagement officer on our social prescribing project, My Social Prescription, here at Community 360. Social prescribing is a free signposting service to help people make positive changes in their lives and within their communities by linking people to volunteers, activities, volunteering community groups and public services. This helps people to feel more involved in their community, meet new people and to make some changes to improve their health and well-being. Social prescribers have conversations with people, focusing on what matters to me, and take a holistic approach to people's health and well-being. I recently supported a young lady, Jess, with low-level mental health. Jess explained that exercise is key to supporting her health and well-being, as well as her mental health. She was already attending gym classes, however really wanted to access her local swimming pool, but could not afford to do both. Using personal health budget funding for those with low-level mental health, I supported Jess by providing her with a 3-month membership at her local gym, which has a swimming pool. She signed up immediately and now attends regularly, accessing the pool and classes there. During our conversation, Jess also mentioned transport barriers to accessing local appointments at the town centre. Having learned about our community transport, Jess has now become a member so she can access the town and her appointments. Jess was grateful for the support social prescribing has provided and is much more aware of the groups and services available in her area.
Community 360 work alongside the Discharge Hub 7 days a week. Working alongside different departments, we strive to offer support to patients to the best of our abilities. In 2021, we introduced a Pathway Light, and this is a specific social prescribing pathway designed to offer social prescribing within 24 hours of hospital discharge. This pathway is intended to empower citizens to be best prepared and confident to manage at home. The aim is to support discharges and lower hospital readmittance. This support can offer signposting, enablement, volunteers and phone calls. And we also have a welfare call service to check in on patients that have been discharged within 24 hours. Lastly, our Discharge Pilot Fund is to support patients to facilitate a timely, safe discharges from pathways 0 to 1 on a time limit of up to 4 weeks.
So we've got two ends of the service, haven't we? We've got the South Norfolk Council end, which is quite a mature sort of end of the service, covering 2 primary care networks there, and they are averaging just over 3,000 referrals a year, aren't they? And then in the Broadland area, we've just started, and they managed to do well over 100 in the first 4 weeks, which was pretty good from a standing start.
And it is growing.
Yeah,
already for this month. We will be well over that.
What I find really beneficial, and also the network we have behind us, because we can really support the customers, their patients, in this person-centered holistic approach. You know, a GP can't deal with a debt problem, which we know welfare rights and debt are, you know, a big part of our biggest referral, isn't it?
Yeah, to that, and mental health and well-being,
Yeah.
isn't it?
And housing.
And housing then is the is the next one.
And for the medical team to know that there's a person at the surgery, and it doesn't matter, you know, if it's the GP, the nurses, because you really are a part of the team and they know you, and even then the administration team, they know if somebody rings and they have a problem with mold on their walls, you know what, send it to the social prescribe.
It's absolutely key, isn't it, to sort of having that sort of physical presence in the GP surgeries. That's what makes it work. I don't think primary care refers to services. I think they refer to people. And once you are a known face in that surgery and part of that team. That's what makes it work. Like, sort of just being the front face for, because we are the front face, aren't we, for over 60 different agencies, right, with an immediate access to those people to refer on. That does increase our capacity, I think, for being able to deal with the volume of stuff which we know primary care will send through it. I suppose what some people might find quite unusual is the fact that we're doing this as a local authority. Yeah. So we are the local council who are actually the providers of the social prescribing service, which is quite unusual. I think that works, and I think that's a real good demonstration of local authorities working hand in glove with primary care. So once we move towards integrated care systems, you can actually see it writ large on a day-by-day basis, can't you? So you've got the local authority, you've got the NHS, and you've got all our VCSE partners, plus our wider networks, all working in a joined-up way to deliver that service to the patient. It's not the customer's fault, is it, that we set up services and make it so complicated to find your way through, particularly if there are multiple needs. So what we're there to do is just simplify that process.
Yes. Yeah. Yeah. And I guess because we have all the support around us, we are able to do so many different things because we know we have all our colleagues, or all our social support groups, or all our volunteers, or the voluntary sector services, commissioned, uncommissioned. We just know where to go.
The question that GPs ask me in the first instance when we go through this, well, how can one person deal with all these issues? And the answer is,
Okay, it looks like that's the end of what it's going to show you. So I appreciate that we have been, we've taken over time, which I apologize for. I think the technical issues sort of got in our way a little bit, but it's been really nice to be able to share all this with everybody. I don't know if there's any time for comments or questions or anything like that, but we'd be happy to talk to people in the networking sessions as well about opportunities and all of the offer here in the East of England. Thank you.
Thank you very much, Gina. Despite the technical hitches and that bit of lag between the sounds, which made for a few comedy moments at times, I think what that showed was the amount of connection that there is in the East of England. And I was thinking right at the end how great it is to hear the local council as well as the clinicians, and also really great to hear from people, their experiences of using the services, and actually just get that really sort of understanding of how you have all worked really hard, Tom and Tim and Sean, with all sorts of providers to get this joined up approach. And again, that's something that we're seeing across the country as there's the maturing of the connections, which is fab. So we're just really, I suppose I want to give the final word to Tom, Sean and Tim. Literally, you know, 10-20 seconds each. Is there anything you'd like to say as we wrap up this session? Let me go to Sean first.
So I think there's still loads more work to do. We have a huge network. We've got some amazing organisations out in the community linking with their link workers, starting to work in different ways, but there are some great things to achieve. So children, young people, linking to our community much more closely. So yeah, I'm looking forward to the next coming years.
Thank you, Sean. Tom Watkins, I'm coming over to you.
Thanks, Marie. So yeah, as Sean said, still lots of work to do, but I think what that video really showed was that there is an enormous diversity and an enormous array of fantastic people involved in and committed to making social prescribing work in the East of England. It's an enormous privilege, and I just wanted to say, just representing today.
You've got a Mo t-shirt. Excellent.
I do.
You've got Mo t-shirt. I'm still waiting for mine because it will match my walls, you see. Tim, let me come over to you.
So I'm proud to be associated with such amazing stuff going on across the region. I think Michael said yesterday something about what a collaborative world this is, social prescribing, and I just think that's fundamentally important to everything we're doing. Those networks, and we've built them, we want to make sure that they get maintained, enhanced, developed further, and more people can join in, because I think most human beings want to do this stuff.
Yeah, thank you, Tim, that's great. If we cut to Sean just for a moment. Sean, hold up your t-shirt. Is it coming to Sean? No, it's still on Tim. Andre, can you just cut to Sean? I don't know if you can. Maybe it's not going to happen. She's also got her Don't Medicalise Personalised t-shirt. There we go. So we expect you to be wearing that in the breakout sessions, Sean. So thank you very much, everyone. Can I say a really massive thank you to University of Essex and to Gina and to Jagana for putting all of that together and going and visiting different people and really getting the voices from a region. And we really appreciate the effort that you've put in there. I'm just going to say, please go and get your lunch now. Get something and then go into the networking lounge and carry on conversations with people. It's really good fun in there. And we've had about 150 people in just chatting and continuing the conversation. So have a go at that if you haven't already. And thank you. Enjoy your breakout sessions.